Good afternoon, everyone, and welcome. My name is Carrie Craven. I am Administrative Specialist for KCMPA, and thank you for joining us. First off, we ask that while the webinar is in progress that you mute your phone lines to ensure that everyone can clearly hear the presentation. You can press *6 on landline phones to mute, or the mute button if you're on a cell phone. If you have a question, you can ask it via the chat window or at the end when we unmute the lines for Q&A. So joining me today is Cindy Campbell. She is Director of Clinical Strategies for KCMPA, and Cindy is going to talk about addressing care gaps. Cindy?
Hello, everyone. Hope you all are having a good day, and thank you for that, Carrie. So thanks for attending our next series in the KCMPA webinar series, and we're discussing addressing care gaps, as Carrie said. So before I launch into this webinar, I kind of want to just lay something out and that we had discussed last month, if you were on the call, that we really want to kind of go back to some fundamental elements of primary care and some of those fundamentals of a high-performing practice. So last month we had talked about the huddle. This month we're going to talk about addressing care gaps. So the reason I kind of wanted to go over that is because a lot of this you're going to be like, wow, this isn't like something that's new. It's not going to just knock your socks off. But what I really want you to listen to is more in the context of as a refresher and just kind of going back and just reviewing some of the basic fundamentals. And, I think it's always a good thing just to go, oh, gosh, is this something that we're doing? Is it something we've really ingrained in our practice and we're doing this so well? Or, we kind of started doing that and we kind of need to get back on track. Or we need to refine our practice operations. So I just thought I would, just kind of put that out there before and just kind of, in the context of how you hear the material and how you'll be able to, what I want you to take away from the webinar today. So with that, we will go ahead and get started. We're going to talk a little bit about what defining care gaps, what does it mean? We use the term, but what does it really mean? How do we address it? And then who is addressing it? What are care gaps? So when we talk about care gaps, what we're really looking at is looking at the needs of the population by their age, gender, disease, wellness. So we're kind of stratifying them out by in specific, areas, and we're identifying what do they need to keep them healthy and to keep them well. When we talk about care gaps, we really want to think in the terms of that we're moving from this reactive kind of a traditional way that we've always practiced of the patients, they have a need for care, they get sick or they have some type of a need and they make an appointment and they come in. But where we really want to move to is from this reactive traditional state to proactive. So we really understand what patient populations need according to evidence-based guidelines to help them, to keep them healthy. And we help them to plan out their routine visits. We help them to plan out care in advance. We stay on top of it and we notify them. We let them know, hey, it's time for you to come in. So it's really just being proactive and starting to move from that kind of traditional where we've always functioned from a reactive state to proactive and anticipating the needs of our patients. Now, that's not to say that, patients aren't going to still need care and they're not going to get sick and have to come to the doctor. That's, we always know that's going to happen. but this is just looking at it in a different context. So when we talk about defining care gaps, we are talking about the population health, and population health, it is broken up and identified in 3 categories. We have individuals who have a major health event or some type of a major disease state where they need a lot of healthcare resources. We have those patients that have some type of a disease process. They might be, it's more of a disease management. It might be moderate to a high risk level. And then, of course, we have the wellness. So those patients that are healthy, they're considered low risk. So this is how we really kind of break up the population of people when we talk about population health. So then when we talk about care gaps, what we're really doing is we're taking all of those 3 categories and we're identifying the healthcare needs in all of those categories. So now we're stepping back and we're thinking, how, of these patients, who needs annual wellness visits? Who needs preventive type screenings according to age, gender, immunizations, or certain care needs according to their disease state or diagnosis? So we're not just looking so much just at one particular person. We're really kind of stepping back and we're looking at these people in groups and we're looking at what evidence-based guidelines recommend, and then we're being proactive. So how do we do this? Well, first of all, you have to know what your patient population is. And it can't just be, I think that, we have this kind of many diabetics, we might have this percentage, but really having a good understanding of what your patient population is made up of can really help you to then identify what your care gaps are and create a plan around addressing your care gaps. So just things like how are their needs determined before they call for an appointment? So how does that happen in your practice? How are we being proactive and we're determining the needs of our population? Are we doing it based on age, gender, or a disease state or a diagnosis? And how are we focusing their care around preventive and wellness? And we're focusing it so that they're not getting, if they do have a certain disease, they do have a chronic condition, that they're not getting any worse, they're not worsening. But then also we need to look at understanding our quality measures. So what quality measures are you meeting or are you working towards in your practice? And then also knowing your payer quality incentives and understanding how those care gaps play into that. And that, you want to ensure that you're meeting those quality measures and, getting those quality incentives around those, what those measures are, and those care gaps are integrated in your workflow. And then how do we do this? How do we know where our care gaps are? How do we get the information? Well, we really need to use the reporting systems that we have. So I know some people are going to go, they're going to kind of chuckle when I say this, but your EHRs. The EHRs have vast data in them. Your registries, payer reports, and some payers have really good registries as well that you can run reports and help to identify what those patient needs are. A couple of resources that KCMPA has is Health Endeavors, and that's based off of claims. So that would be looking at the Medicare fee-for-service group and looking at those claims data and then being able to see what claims have come in, what needs are still out there. And then we have the health metric systems, their SQI, or Systems for Quality Improvement, which monitors and tracks your GPRO measures, your ACO measures. However, it does have many more capabilities as well. So I wanted to just throw this in here as a really good example of a care gap that you can access, which would be the annual wellness visit, and this graph is from our health endeavors. So what this is showing is for our ACO practices in KCMPA, so when we're looking at groups, okay, of our population, we're looking at the Medicare fee-for-service population, we can see that 42% have had an annual wellness visit, and we still have a 55% that's outstanding. So what this is really telling us is, oh, we have this is a care gap that we can start closing in on, that we can work on. And then you have the further capabilities of drilling down and pulling those patients. You can drill down to the practice level and then pull those patients that do not show claims for an annual wellness visit. So I just thought that was a really good example of a care gap that could be addressed and how you can use the systems that we have in place. So addressing care gaps, who does this? So first of all, roles and responsibilities of addressing care gaps falls across the care team, just as any high-functioning practice, utilizes the care team to get many things done. It's not just something that falls upon the provider or the physician to be managing, but it falls across the care team. And there's a lot of different aspects of addressing care gaps that the care team can pick up across the board. So a lot of parts and pieces. So we talked about internal processes and workflows to address those patient needs. So what type of things are happening in your practice? What processes do you have in place, or do you want to get in place? How do you pull those reports? How do you develop those workflows in order to address those needs? And one of the things that I think is a good example as well are looking at those patients. I know there's a few practices that you are doing this, and you've got a really good process in place of looking at those patients that are coming in a week or 2 weeks ahead of time that are on the schedule, and you're identifying what care they need, what type of preventive. Have they had their breast cancer screening? Have they had colorectal screening, cancer screening? Have they, had pneumonia shots, flu shots? So those different types of things are looked at. So, that's a good example, and I know a lot of our practices are doing this as well. So I want to talk a little bit about a role that we're seeing in primary care that is really starting to become almost a critical role in primary care. And that is the care coordinators, health coaches, care navigators. So there's many different names for them, and how you choose to what you choose to call them is really going to be based a decision based at the practice level. But these are folks that are really spending their time and their days calling these patients, looking to see what care gaps are out there. It sounds like we have somebody just join. If you could mute your phone, that would be great. If everyone could just mute their lines, that would be great. We're getting a lot of feedback. Okay, I don't hear me, so I'm going to try to go ahead. So what I'm reading in the literature around this role is that it's very quickly becoming a role that the practices, the primary care, cannot go without, that it's second to the practice manager. And that though these folks don't always need to be a clinical person, what they're finding is it does need to be someone that, or at least someone in the practice that's comfortable with technology, with different reporting systems, can pull information, can look through data and filter through data. And So, you know, what their role is really going to be spending their days reaching out to those different patients, getting them in. What skill that they do have that is necessary is customer service. So what's interesting is what I'm reading is they're pulling people into these roles that have no clinical background at all, but have more of a customer service background. So I thought that was interesting, that's kind of a fascinating trend happening. But the whole point is that this is really a new role, I would say, in the past couple of years that primary care is seeing, but it's something that we're going to see more and more of. And in fact, for just about any patient-centered medical home or any type of a practice that is, you know, advanced, they're going to have these type of roles in place. And some of the pushback that I've heard is, well, oh gosh, this is another overhead, it's more expense. But really, these roles, what we're finding is because they're actively getting these patients in, that they are more than paying for themselves because they are actively getting patients into the practice. And when these patients normally would not have come in, and that they are more than paying for themselves, if not, you know, double or more. So I wanted to just kind of, you know, give a little bit of information around that. I know a lot of the KCMPA practices do have care coordinators in place, and which I think that tends to be the term that, or the title that most of the KCMPA is giving. But there are other titles out there as well. So. Okay, so that's really all I have. Like I said, you know, this isn't a lot of new material. I know that you all have heard this, but I want you to be able to take it back and just kind of reflect with your practice. And just some discussion points that you can take back is, how are we addressing care gaps? Are we capturing, you know, these patients? Do we have a good workflow in place? And do we have people that are responsible, that know that's their role, pulling this data, looking at this data, making those outreaches, and just making it happen? So that is all that I have. Does anyone have any questions, any discussion, anything that they would like to share around how their clinic is doing this? Having some real life examples is always the best. Okay, so our next care team consortium, we will be following this topic. Again, we will be doing some roundtable on annual wellness visits, preventive, and how we're achieving that, and just in the practice, and sharing experiences, sharing challenges. And then we will also have a presenter that has some solutions for us to be able to get preventive type of notifications out to our practices. So that will be at the, I believe it's October 27th meeting, and it will be held at Clay Platt. So thank you everyone for your time, and you have a great rest of the week.